DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there folks, thanks for joining me today on DocTalk. We're going to have a great show today. I'm Dr. Dan Thompson and I'm going to be joined by Dr. Hans Katzir, and we're going to be talking with him about residues, about pharmacology in food animals, and what we're doing at Iowa State University to prevent residues and antimicrobial resistance. Stay tuned and enjoy the show.
We were having some conception problems with the cattle, so our local vet came and we took some blood samples and found that some of the donor and recipient females were significantly low in terms of selenium and copper. With the use of Multimin, we were able to increase those levels back to a normal level. We've seen a significant increase in our pregnancy rates on our recipient cattle.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Hans, welcome to the show.
Thanks, Dan. It's great to be here.
Well, it's great to have you here. Folks, this is Dr. Hans Katzir, and he is the section leader for the Pharmacology Analytical Support Team here at the College of Veterinary Medicine at Iowa State University. I almost said Kansas State University, but I'm the one from Kansas State University, and Dr. Katzir is here at Iowa State University, and it's great to have you on the show and to find time to get you away from all the things that you're doing to be here. You know, what are some of the issues or what, you know, when we start to think about the pharmacology and food animal pharmacology, what are some of the things that you're seeing, or some of the kind of the 30,000 foot view of pharmacology issues in food animal production?
I think production agriculture in general is under great pressure to demonstrate that we are responsible stewards of antimicrobial use on our production systems. I think that we've becoming under increasing scrutiny, especially from legislators, about how we use antibiotics because of the concerns about the emergence of drug-resistant bacteria on the human side. And we realize that agriculture is not solely responsible for the issues that we see, but it is important that we can demonstrate as an industry that when we do use antibiotics to treat animals that are sick, that we do use those in a responsible manner.
Yeah, and it's a huge debate at a federal legislative issue. When you look at what the Food and Drug Administration, how they're starting to be involved, the potential of removal of products from production animal medicine because of the potential resistance problems that we see in human populations, it really has the potential to take away some of the technologies that we use on a day-to-day basis to produce wholesome, safe food.
Absolutely, and we're increasingly starting to see that some of the applications of those drugs, for example, for growth promotion, those label claims are being removed by FDA, and that those drugs can only be used now under the veterinary feed directive. So increasingly producers are going to have to work more closely with their veterinarians when they use these antibiotics in feed to make sure that they adhere to those new regulations.
And I think it's important for producers and veterinarians that are watching this is to understand that the over-the-counter drugs, when you say a veterinary feed directive, that means you're going to have a prescription in the future, instead of being able to go down to the farm and home or to the ag store and buy something over the counter.
Absolutely. I think what we particularly want to emphasize is that producers work closely together with their veterinarians to be able to use these drugs in a responsible manner, that they identify the populations that will benefit most from receiving the antibiotics, and when they do use those antibiotics, that they have protocols in place with their veterinarians to be able to use those in a manner that we can defend as being a responsible use of antibiotics.
Yeah, and I think it's, and like any other problem that we have, few bad apples spoil the bunch. Our producers and veterinarians work hard day to day.
Absolutely, absolutely.
Well, we appreciate you being here today. I'm excited to jump into some of the programs that you've started here at Iowa State and have running, and take a break, and we'll come back after a bit.
Sounds good.
Thanks for watching DocTalk, and we'll see you after the break.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. And by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
Hi there folks, Dr. Dan from DocTalk. Next week, join me on DocTalk as we're going to discuss lameness in beef cattle. Be sure to join me here every Monday afternoon at 4:30 p.m. Eastern Standard Time on RFD TV, and I'll see you down the road.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it from an ATV, on horseback, or just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Normycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Welcome back to DocTalk. I'm Dr. Dan Thompson, and I'm joined by Dr. Hans Katzir here at Iowa State University's College of Veterinary Medicine. And you have a service set up in clinical pharmacology or applied pharmacology here at Iowa State through the Diagnostic Laboratory and Production Animal Medicine Group. Let's talk a little bit about the services that you're providing and how that's important for our industry.
The Iowa State University Diagnostic Lab is unique because we do have a laboratory that's particularly dedicated to detecting drugs in different matrices, as we call them, so in feed or in tissues or in urine or in milk of animals. And so this is a service that we can provide to producers through their veterinarians to allow producers to answer three of the key questions that they typically have when it comes to drug use. And that's, firstly, did the animal actually receive the drug that I think it got? The second question is, if it did receive the drug, did it get enough of the drug to actually be effective against the disease we're trying to treat? And then the third issue that we run into quite frequently is, if they did receive the drug, how long do I need to wait before that animal is safe to send to harvest for the consumer to have at the end point, so that we don't have any residue issues?
I think a lot of the time, you bring up a couple of great points. I think a lot of the time we're so worried about the withdrawal and the residue that, at least on a food safety side, that a lot of times we forget about testing to make sure that we're getting the proper amount and the proper dosages into the animals too to treat the disease.
Yep, no, absolutely. And I think that's one of the issues that we've received quite a few requests on, and it's a test that we're actually working on developing, is when folks are buying high-risk cattle and sometimes they've received some guarantees that those animals have been treated a certain way before they get shipped. And when those animals start breaking with disease, very often the questions we get from producers through their veterinarians is, how do I know that this animal was even treated? And so our service is particularly working towards developing tests so we could identify the treatment status of these animals to see if it is a treatment issue or if there's some other issue ongoing in those animals.
And then I'm going to make the assumption that when you get into disease issues or you get into treatment failures, that you can actually take samples and work with practitioners then to see the pharmacokinetics or to see that how to best treat these animals. Maybe it's a delivery method of a drug or to look at different opportunities.
Yeah, and that's an excellent point. One of the issues we run into is when we give a drug in feed is that we can't guarantee that the animal's actually consuming enough of that feed for that drug to be effective. And we've done some really interesting work where we've looked, for example, at medicated mineral being fed to groups of cattle out on pasture, and it's amazing to me always what the variation is that we see in the concentrations of drug that actually gets into that animal. So even though you might be providing a medicated mineral to treat a disease like anaplasmosis, some of the animals within that group just don't receive enough of the drug for it actually to be effective, and that's one of the services that we can provide, is to collect some blood samples from those animals and actually see what the level of the drug is to make sure that they are actually receiving enough of it for the drug to work.
Yeah, and I think that when we take a look at you know, and I've done some of that mineral work too, and it's amazing to me when you give it in an injection, you know the animal got it. And some of the feed grade things, you know, there is such a variation, but understanding the variation and understanding the ease of application is also part of it. If you can't get them caught, you can at least feed them.
Yeah, absolutely.
Well, we're going to take another break, and when we come back, we'll continue. We'll be back more with Dr. Hans Katzir here at Iowa State University as DocTalk is on the road.
This Meet the Veterinarian is brought to you by Merck Animal Health, the science of healthier animals. Dr. Robert W. Sprowls, Resident Director of Texas A&M's Veterinary Medical Diagnostic Laboratory, was recently honored with the Texas A&M AgriLife Vice Chancellor's Award in Excellence for services, specifically diagnostic services. Working with both large and small cattle operations, Dr. Sprowls brings his skills as a diagnostician, pathologist, and leader to a complex role.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. TrueTest Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey, welcome back to DocTalk. I'm Dr. Dan Thompson, and we're back here at Iowa State University's College of Veterinary Medicine with Dr. Hans Katzir, and we're talking about some of the services supplied here at Iowa State's Diagnostic Laboratory, and specifically on the pharmacology and analytical side. What are some of the tests that y'all are running, or some of the more popular things that you're looking at these days?
Our lab started off as a racing chemistry lab, and so we used to do the forensic drug testing for a number of jurisdictions across the country, and we still continue to do that for the state of Iowa. So basically what that means is it's similar to the Olympic athletes, is that we make sure that those athletes are running without the support of any performance-enhancing drugs.
Only we're doing it.
And so
dogs and horses.
Yeah. So it's a variation on the theme that's been happening in human medicine for some time. But in addition to that, we're using the same technologies now also on the food animal side, and we do provide support for a number of states that have their state fair samples tested by us to ensure that the animals that are competing at the state fair are doing so fairly. And that's a service that we feel is very important to provide to make sure that everyone can have confidence.
What are some of the more important things that you do analysis for?
Some of the more common things that we would see issues with would be drugs such as the beta agonists that are used in feed quite frequently to try to build lean muscle mass in animals, and sometimes those aren't approved for use in some of the species, for example sheep. And occasionally we will see samples that have the presence of the drug in those, and extra label drug use of those compounds in a species such as sheep is illegal.
Right.
And so it's important for us to keep an eye on whether those drugs are being used in a manner that they're not approved, and one of the ways we do that is to test urine from competing sheep to ensure that they're clear of the drug.
Lasix, different things.
Lasix we'll see sometimes on the racehorse side, and that's something that some jurisdictions allow it and some don't, and so that's another thing that we monitor for from time to time. And then there's also the anabolic steroids that we will see from time to time being used, and so it's important in those cases to be able to distinguish between whether it's a male animal and it has its normal hormone profiles, or whether it's a drug that's being used illegally.
Right. So I assume residues and milk residues and things to that nature outside of the racing horses and the state fair animals, you're doing some other residue testing? Yeah, and that's a very significant part of the work that we do. We have an assay that we can screen for 41 different drugs in milk. And so particularly this time of the year, we do see quite a few cases where lactating dairy cattle are accidentally treated with drugs that are not approved for use in a lactating dairy animal. And a classic example is ivermectin. And I would urge certainly watchers of the show who are producers to take care to make sure that they read the label before they apply those drugs, to make sure that the animals are in fact appropriate for treatment. And when we do see those lactating cows being treated with ivermectin, assuming that the states allow us to do the testing for them, we can assist those producers in testing the milk from those animals to make sure that they don't contain any traces of this drug, so that when we do say that they're safe to be consigned and shipped, that milk is safe for human consumption. 41's a lot.
Yep, it is a lot, and we do cover a lot of drugs that aren't specifically approved for dairy cattle, but because of the way many of our production systems are structured, sometimes animals do get treated with a drug that's not specifically approved for use in a lactating animal, and so it's important for us to be able to provide that service to make sure that we can assure the consumer that that milk is safe for consumption.
Well, thanks. We're going to take a break, and I think it's also important to always say that's the reason why you need that valid veterinary client-patient relationship. You're watching DocTalk, and we'll be back in a minute.
We do use multi-min in our cow herd, and we're finding that there is a benefit. Seems like those cows breed back better, and we also found that by giving our bulls a shot of multi-min just before we turn them out, we really get a kick out of that. I've definitely recommended multi-min to several people, and it's a good product.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd. This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there, folks. Welcome back to DocTalk. Dr. Dan Thompson here with Dr. Hans Katzir, and we're on the road at Iowa State University's College of Veterinary Medicine, where Dr. Katzir is the team leader for the Pharmacology Analytical Support Team here at Iowa State University's Diagnostic Laboratory. And when we're talking about the different things that you test for, I think one thing that's important is, well, how do I get a sample sent in?
So typically what we would encourage producers to do is work with their veterinarians, make sure that they have a valid veterinary patient relationship in place with their veterinarian, and if they do have an issue with an animal that they would like to have drug tested, to have their veterinarian contact the diagnostic lab, and we'd be happy to visit with them, hear about that particular case to determine the optimal time for us to actually test that sample. For example, the ivermectin case with milk, we know that it's going to be 20 to 30 days before that sample would actually be at a level that we could test it to see if it was safe. So there would be no point in testing multiple samples before that time. And so we like to work with those veterinarians to give them some suggestions or recommendations to take back to the producer, and then to coordinate the submission of that sample to the lab. Another example of some services that we do provide would be if somebody is perhaps buying an animal that they're spending a lot of money on, whether it be a horse or breeding stock or variety of different species, to submit a sample to the lab for us to test to make sure that that animal doesn't have any drug levels in it. And again, if they work through their veterinarian in order to accomplish that, that would be the optimal way for us to be able to provide a service to them.
Probably won't know if there's any drugs to mask pain or something of that when you're buying one of those animals as well too.
Yeah, and we do receive quite a few samples from folks buying high-dollar horses, especially cutting horses or competing horses on the quarter horse side, where it's a concern if that animal is lame and that may have received some drug that would mask the lameness at the time it's being purchased. And we would be more than happy to work with those veterinarians to be able to test those samples before the purchase is completed, to ensure that that animal is actually sound and that there aren't any issues with drugs that might mask some of the symptoms.
So work with a veterinarian. The veterinarian can submit the sample to y'all. And I'm sure that there's a place on the web.
That's correct. Yeah, we do have a place on the web. It's on the Iowa State Veterinary Diagnostic Lab websites, and we work very closely together with our toxicology section here at the lab. And so samples can be submitted through either the toxicology section or directly to us, and we'll complete the screening analysis, report the results back to the veterinarian, who can then work with the producer in order to ensure that that animal meets the optimal withdrawal period, or that we could take some steps to ensure that those animals are adequately medicated.
Does it have on there a list of the proper samples to take and how to mail them and how to package them and things like that, 'cause that can be important as well?
Yeah, absolutely. And we do have a list of which drugs we test for, and we also have some guidelines on there and what type of samples we'd like to receive, and so they could work with their veterinarian to make sure that they meet those requirements.
Well, incredible service that you provide, and not only through the analytics here, but you do a lot for our industries as well, and I really appreciate you spending time with us today.
Yeah, and I appreciate the opportunity to visit with you, Dan. It's great to see you again. It's great to have you up here in Ames, and it's a really service we enjoy providing, and we look forward to working with veterinarians and producers in the future.
Sounds like a winner. Thanks for watching Doc Talk today. Remember, if you want to know more about what we do, you can find us on the web at www.doctalktv.com. Remember to always work with your local practitioner. I'm Dr. Dan Thompson. Thanks for watching Doc Talk today, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, Sure Trace Mineral Supplementation by Timed Injection.
My name's Tim Todd. Along with my wife Chris, we own and operate Green Mountain Angus Ranch out of Rygate, Montana. We've been in the Angus business for about 30 years now. We sell about 350 bulls a year. We have a production sale in the fall, the third Friday in November. And we have a private treaty sale in the spring. We've been using the Multimin product for about 7 years now. We started using it off the recommendation of our embryologist. He suggested that we give our recip cows a shot prior to putting embryos in. We had a real good conception rate that spring, and we've been using the product ever since. This area of Montana can be a little deficient in copper. That's one of the three main minerals in Multimin, and so with that we brought our copper levels in our cattle up to where they need to be. We've seen an increase of 5 to 6% in our conception rate in our AI program. You start getting 30 to 40 more AI calves in a year. We're showing a huge return by using the product in those regards. We give our cows a shot of Multimin pre-calving for the immune system of the unborn calf. She will transfer the minerals into the unborn calf through the blood system. When the calf is born, he has a high level of mineral in his liver, which will help with his immune system. In our particular operation, we lease a lot of pasture, so it's real important for these cattle to stay healthy. We don't get the opportunity to check them like we'd like to. The least sickness, the least foot rot we have, the better off we are. So with the use of multi-min, that's two of the big benefits we've seen. Healthier cattle, less maintenance.